Last year we talked a lot about targeted therapy for lung cancer, and this year the theme's going to be immunotherapy and chemo-immunotherapy combinations, many of which are practice changing, and I'm excited to share with you. I know most of the updates here are from ASCO, but since last year we've had practice changing data from ESMO and AACR, so I've included data from there just because it's changed practice and is very relevant to what we're doing today. So like I said, we'll review some of the recent FDA approvals for lung cancer, we'll appraise some of the new frontline treatment options, and we'll also talk a little bit about some emerging targets that have some strong, encouraging data coming out. So over the last 5 years in lung cancer, we've seen immunotherapies come into the second line. We've then seen it tested in frontline as single agent or in combinations with chemotherapy. And I'm not going to present much of the data at the earlier stages. We will touch on stage 3, but there are trials now ongoing to give this neoadjuvantly prior to surgery to see if that improves long-term outcomes. So we're going to focus more on the middle today, but this is already moving forward into earlier stages. So last year, right before the presentation, a phase 2 study came out from Dr. Langer showing how a combination of chemotherapy with immunotherapy may be beneficial regardless of PD-L1 expression for patients with adenocarcinoma of the lung. There were only 150 or so patients in that study, but it was positive and it led to accelerated approval by the FDA. But since then, we've had a large confirmatory study that was presented this spring, and that's what I'll focus on for the next few minutes here. And this was a Keynote 189 study presented by Dr. Gandhi. Here, patients were randomized 2-to-1 to receive a combination of carboplatin and pemetrexed with either pembrolizumab or placebo. Over 600 patients were randomized and participated in this study. Just some things to keep in mind. This was non-squamous, non-small cell lung cancer. Patients with EGFR or ALK mutations were excluded. They did not allow symptomatic brain metastases, but some patients with small asymptomatic brain metastases were included. Patients with a pneumonitis requiring steroids were not allowed. And again, regardless of PD-L1 expression, people were able to enroll. I'll note that when patients completed the 4 cycles of the platinum doublet, they were allowed to continue with maintenance therapy, but investigators were blinded. So they were either getting pembrolizumab with pemetrexed or placebo with pemetrexed. Those who were on the pemetrexed with placebo were allowed to cross over and then receive immunotherapy, but at the time this was reported, about 40% of patients had crossed over from that arm, as shown here as 41%.